Hi everyone, welcome back to my channel. So as you guys know, I started residency and I just want to give this little spiel before I start talking about my rotation. But sometimes don't you just feel like down on yourself, think that you're not good enough or you're not doing enough? I've been in that funk lately. Like I feel like I should be doing more. I feel like I'm not where I'm supposed to be. And you're always your own worst critic. So I always try to step back and reevaluate and just do my best every day, try to better myself every day. And in the field of medicine, you're constantly learning about medicine, about people, about yourself. So every day, I try to learn a little bit more. So I just had to give that little spiel. I just been feeling, I don't know. Yeah, so I've just been feeling like not the best. And that's because I've been down on myself. But I just want to let you guys know that you're not alone if you feel this way. Everybody is their own worst critic. Don't be so hard on yourself. As long as you try your best, do your best, that's all we can ask for. So, what I've been up to in residency. I just finished my geriatrics rotation, and when I was in medical school, after every rotation, I would tell you guys what I did and what resources I used to study, what I thought was useful to study beforehand starting the rotation. So I thought I'd share that with you as a resident. So this past rotation was my geriatric rotation. So I was in nursing homes, SNFs, skilled nursing facilities. There's like this memory clinic. But yeah, it was a lot of skilled nursing facilities. And I did a variety of things. I took care of basically very old chronic patient care, and then I also did acute things, like I got to do knee injections, and then I would also transfer people to the hospital if ever they had acute exacerbation of something, like if someone ended up having pneumonia, we'd have to send them out. Luckily no one coded when I was there. Most of them are DNR anyways, do not resuscitate. So basically that was my experience. It was a pretty chill rotation just because it was outpatient. I was not on call. I did not have to go in after I finished my notes. So the three things that I think are really key to taking care of geriatric patients is, number one, what is their goals of care? Sorry, my camera just turned off for some reason, but hopefully it's not glitchy. But anyways, so I actually saw this a lot in the nursing homes, and specifically one patient who we talked to finally realized that, you know what, I'm probably not going to get any better, and that this is the best that it's going to be. So do I still try all these interventions to try to get better, get healthier, when I probably won't? Or should I spend this time just being comfortable, being with my family? And the hospice can actually do that for patients. They can help patients with their short-term or long-term goals. What is it that they want to accomplish before they leave this place? So I feel like that's a very valuable tool for patients. The second thing that I think is really important to look up before going on these rotations is the different dementias. So there's like Lewy body dementia, most popular is Alzheimer's dementia, Parkinson's dementia. There's very different types of dementias, and you would treat them symptomatically, but they present differently. It's good to know like the different types, because at the end of life a lot of people have dementia. And along with dementia, the third thing is depression. I think the two can actually contribute to each other. The depression gets worse, the dementia gets worse, and so we always want to treat the depression and anxiety part. Usually we just use medications for that. But I think depression and anxiety, a lot of people, even in a younger age group, can relate to, because it affects many people. I think I recommended this book to a lot of people, Dr. Feeling Good. It's called Feeling Good by Dr. David, I think. I'll link it in the description box down below. But basically it's kind of like CBT, cognitive behavioral therapy. It teaches you ways to break that rumination cycle. Ruminating means just thinking about something over and over and over and over again, and actually makes you more depressed. Cognitive behavioral therapy, or just giving people tools that they can utilize to actually realize what they're feeling and how to control what they're feeling, rather than just giving them a medication and people being dependent on it, is a good idea as well. Medication is a great thing and it helps many people with depression and anxiety, but I think it's also a good idea to give people the tools in their tool belt to manage their own anxiety on top of medications. So yeah, that's all I have for today. It's probably going to be a really short video, but in the next few weeks I want to film a video of an update of how Wyatt is doing. He's almost 3 months now. How I'm doing 3 months postpartum. So yeah, so keep an eye out for that. If you guys enjoyed this video, please give it a thumbs up. If you haven't already, please subscribe, and I'll see you guys next time. Peace. Oh, I know, sweetie. You're just so talkative. Yeah. What else? What else?